We can't all have a nutritionist, a doctor 24/7, but we can start to imagine how good would it be if we could. Oh, I felt terrible last week. Oh, okay. Like I was eating whatever it was I had cheeseburgers every day. It's like I didn't feel good. And here's ways that I didn't feel good. Like, how can we track that and measure that against our own success metrics? How can we then share that with people who can tweak program in order to make it just right for us? And then how do we ultimately feel better, get better, and not feel so alone? And I think as we move into this more personalized model of care, that's the world that I want to create, where there is a sense of, there is that data and it's going to the right expert and I can get the help that I need. And I do have 24/7 guidance. And so we are using that technology at Miri to do as much of that sort of bridging as we possibly can.
Hello, Amy. Thanks for joining me on The Augmented Life.
Thanks for having me, Michael. I'm happy to be here.
I'm happy too, because to my great disappointment, so much talk about AI seems focused on human replacement, not enough about human augmentation. How can humans plus AI become better humans? And you've built an entire company to achieve ends like that. So, man, this is going to be a fun time.
I'm excited. I mean, I think there's a lot of fear, right? Like there's fear with things that are not known around the tech and now around job replacement or human replacement. And, there's a lot of fear in other boom times of technology as well. Y2K and, the internet in and of itself. And, we've weathered those pretty fine. So I think part of this is around managing anxiety and as we all brave the unknown.
Right. Yeah. I like that. Well, I'm hoping that some of the unknowns that we brave are about untapped human potential. How much better can we get as people? How can we help each other get better? I'd like to kick off with maybe this is a nerdy coaching question, but it's certainly something that I'm obsessed with. When you hire a single purpose coach, if you hire a tennis coach or a golf coach, it's really easy to arrange for the coach to see you in action. Like I'll take you out on the golf course and maybe you'll have a video camera and you can take some video of my swing, right? The observability problem, if you will, is very easily solved. But most of life is not like that. I have an executive coach, but it's really hard to show the executive coach what kind of executive I am, right? I can just take him out onto the course. Now, you're working with coaches in this really sort of broad way, right? Like you're helping humans help humans. How are you using technology to solve that, if I may, that observability problem? How do coaches see their patients or their coachees in action in a way that empowers them?
So, I would love to kind of rewind and think about why you would want to hire that human golf coach to begin with, right? Like, I think it goes all the way back there.
Okay.
Because you can take a golf club and you could go to a course and you could practice on your own with nobody watching. You could probably look up tips on YouTube or on, other sort of articles that you've read or on social media to try and understand how to improve your swing and what you should do. You could get the tips, you could get the education, you could go and practice. Why would you hire a human coach and spend money that way? I would start there. That's where I kind of started. I mean, I'm happy to tell you kind of what I think, but I'm curious if you have a response to that, and that might help in our thinking.
Well, I do, but I don't know how weird
Michael.
This is.
This is about your golf. This is about I'm really going into your golf swing right now.
That's so good. Well, I have no golf game of which to speak. Were I to actually hire a coach, it would be a mini golf coach. But to answer your question more broadly, at least for me, I don't know if others can really relate to this, but I am fundamentally curiosity driven. I learned about the five whys when I think I was studying the Toyota production system. You know, when you're thinking through goals, it's important to ask, well, why? And then ask why again, and then ask why again. And, you know, at an average of 5 times, you can get to like the real answer of what a real goal is like. And I've realized as I run that pattern on myself, the answer at the core tends to be something along the lines of, well, I'm really curious. I have 3 forms of curiosity, I think, that pretty much drive my life. I'm really curious about what my mind is capable of. And I mean that really broadly, not just in the obvious intellectual way, but also in the ways that I've explored with meditation, now with multiple kinds of meditation. I'm really curious about what my body is capable of. I don't think I know. I'm continuously surprised, and I only get surprised by trying new stuff. And then my third form of curiosity is I'm really curious about what we can achieve with cooperation, you know, for various values of we, like, you know, with my startup, with my community, with my family. What are human beings capable of when they cooperate? Honestly, answering those 3 questions is pretty much how I like fill fill my days.
So what I love that answer because you're talking about exploring in the world in a way that you can start to understand via these different dimensional components rooted in curiosity. And when I think to, I come from a clinical background. I've got a master's of clinical psychology and um, a neuroscience background, neuroscience major. And before I started each of my companies, um, I was actually a practicing psychotherapist. And so I've helped a lot of people explore with curiosity different aspects of their life. And when I think about who is the most curious and when are we the most curious in our lives using that clinical hat, I think about us as kids. I'm also a mom. I've got 3 kids. They're so curious. Any parent who's listening knows like they've had to say, I can't answer any more questions right now because it's like so many questions and it becomes too much. But that's really when we're learning the most about the world and about ourselves, and we are intrinsically the most curious. And the response that we get, you know, when things are going well and when we're able to learn the most is when that curiosity is met with a certain amount of mirroring. There's someone there and they're like, oh, okay, so you are learning how to walk. I'm not going to run and make you go as quickly as possible. I'm going to stay with you and we might meander and you can pick up a leaf and, oh, that's a leaf. And now let's talk about leaves now. And it's like, and they're on trees and the curiosity is just able to really flourish and we can really grow. And it's that kind of modeling that I'm really excited about implementing using all the technological advances at our fingertips. It's the feeling like you were kind of talking about, Michael, of, you know, why would I hire a coach? And it's the same way that we use that expression of curiosity to understand the world and ourselves in a deeper and richer way in order to grow the most, is to have someone there mirroring back to us the way that we're exploring so that we can grow and we can learn in the most fruitful way possible. And that's what we can now do using AI.
I like that a lot. I think there's a related question, which is about knowing or being guided about what excellence in a particular domain really is. Like another way to get at your golf question, why would I hire a coach instead of just review some YouTube videos? I guess I want to know from someone who has seen what excellence is. I want them to see me, to give me some guidance about, maybe it's something about the Pareto principle, like am I doing it about as good as someone like me could do it? Right? Like have I started to hit, a point of diminishing returns in trying to develop this skill? Or is there so much more for me to learn, right? It's like if you're a beginner, you don't know, you can't place yourself on the spectrum of excellence.
So you brought up two interesting perspectives. One is about expertise, and I'd say the other one is around trust. Because you could have someone teaching you golf. Let's take golf. I'm terrible at golf, so you shouldn't listen to any expertise that I would say. I can pretend to be a golf expert and get on and tell you what to do. And you shouldn't trust me. You should not trust my advice. If, a major golf, player expert like a Tiger Woods was with you on the golf course, you would do whatever he said. And part of it is because of his knowledge of expertise, and part of it is because you trust him. If you were, and you trust him because he's earned that trust, because he's an incredible golfer. But, if you were to meet somebody brand new that I introduced you to and said, this guy is just as good as Tiger Woods, and you've never met him before, you've never seen him play, you've never heard of him, and I said, trust me, he's just as good, you would want to see first. You'd want to develop that trust before you did every single thing that he said. So even if his expertise was the same, there's a level of trust that comes to play here. And that's really where I'm interested in what you kind of spoke about, which is using this technology to extend the reach or scale trust. A trust of somebody that you already, or a relationship with someone that you already trust, an expertise that you already value. How do we use this tech so that experience can be scaled to many, many more people who want to learn with curiosity from that person?
Right. That is such an interesting model. And it gets powerful because you've chosen the right problem to solve, right? Like you could take a first principles approach looking at the world and say, wow, there's a shortage of helpers. More people need help than there are helpers. We need to automate helping. And that entirely misses these important elements of not just rapport, but actually the foundational elements of relationship building that inspire someone to improve, right? Like that trust is foundational to me putting in the effort of listening and then actually following through with an action plan.
Exactly. And it actually, when I think about all the technology out there and everything that we can do, it's a very fragmented market. And the last thing I want to do is create another product, that's the expert on whatever the thing is and say, come start building trust with this whole new system, when really we can use this technology with organizations and people who've already established themselves as experts and have already built the trust. They've done the hard work already. So, I think it's more valuable to extend that reach than it is to further fragment the system by creating a new product that then you have to develop that trust with.
Right. And it strikes me that you're helping two parties there when you extend the capabilities of the helpers. I think that one of the reasons why there is such a shortage of healthcare providers, of coaches of all stripes, of helpers versus those who need help, is that life in these times is is uniquely hard. It's uniquely complex. There's more novelty. There's more novel problems to navigate these days. So we're all on our own in a way that I don't think people really were 100 years ago in a less dynamic world. But the people helping us are also living lives that are very hard. They might also be overwhelmed, right? Who helps the helpers, right? There's a need for help all the way down. So in empowering people to be more effective and to help more, you're also perhaps guarding them against burnout. Have you seen that?
Absolutely. I think I'm a clinician. I also have been a supervisor before for other clinicians. My prior company was built around a model where we could hire interns to then provide sliding scale access to therapy services. And I've seen a lot of folks who are in the health and health field who are servicing other folks. And there really is a burnout that's just enormous. And, thinking about this only from, I'm also a consumer of health services, and we all know that we need more help than what's out there. And so this is really a double-sided issue. What healthcare is doing to fix the services issue that we have is actually changing the fee for service so that providers are now going to be compensated for outcome-driven results, meaning if you go to see a clinician or a doctor for a condition, that doctor is today paid for seeing you regardless of if you improve your outcome or not. You could be seeing them over and over again for the same condition forever. In 2030, that model is going to change for something that's more outcome driven, meaning you have to be getting better in order for that doctor to continue to get paid for seeing you, which I think is fair. Um, that creates, well, it doesn't create, it highlights the care gap that we're speaking of and amplifies the need for innovation for that care gap more than ever, because what that's saying is, look, we need to find a way to help people actually achieve their goals. If you're talking about golf, if your goal is to become, very, very successful, and you can pay a professional to stay the same in your golf swing and never improve, then, that's going to be different than if that coach is only paid when you get better. And so that'll have a huge impact, but there's not enough people to heal everyone that needs healing. So how are we going to fill that gap? There's massive opportunity there.
I think that transition can't come fast enough because it also speaks to moving from what's sometimes called sick care to actual healthcare, right? If I'm only paying for treatments, then in effect I'm paying to fix problems that maybe shouldn't have arisen. I'd love to pay a partner to keep me healthy for the next 30 years. That's really what I want.
Oh, yeah. And chronic conditions have never been worse. It wasn't, I think in the 1960s, it was like 10% of the population, has had chronic conditions. Today, it's like around 90%. It's insane of folks who've ever experienced something like that, who are in the medical system with those experiences. We're at a place of inflection where we need to solve for this now. And the way that they're trying to solve for this massive impact and rise of chronic conditions is, let's get people better. People are sick. They're getting sicker. They're not getting better. We need to figure this out in a patient-centered approach based on health outcomes and the goals of the patient. And we shouldn't be paying if that's not working. And so, I think there's some drastic measures, because we're in a pretty drastic time, frankly, where we need to see improved health outcomes pretty immediately.
Right. Well, I'm a technologist precisely because of this. I think that if we're all overwhelmed, if we're all living lives that are too complex, everyone needs help, Um, the the you, we can't. If I get help from someone who is living a life that's too hard, and they need help from someone who's living a life that's too hard, it hurdles all the way down unless we can either simplify life, or we can literally reduce the number of problems that everyone faces, or we give people better tools so that they're literally capable of dealing with more. And of course, you're right there in that tool creation. So getting back to what you first spoke about, how do you help people bridge those gaps around skepticism, around fear, so that you're putting practical AI tools in the hands of practitioners, in the hands of people who need help, in a way that they can trust?
So the way that we've built Miri, and this was really born, I'm one of those many, many people who've been diagnosed with a chronic condition. I've got a thyroid disorder. I was put on medication at a young age. With nutritional change, I have been able to impact my hormone scores and not been so reliant on medication. There's a lot of education out there that providers have that they try to give to people, that then there's no personalization and ongoing support to implement those changes. And I saw that firsthand, not just as a patient, but also as a clinician. You can see a therapist once a week. What happens in the in-between time? How do you translate those hour sessions into something meaningful in your life beyond that? And I saw a real gap and need for this service for a while. When I met Boris Kursunsky, who's my co-founder, I had been thinking about this for a while, and he walked into my house with a prototype he had built with one clinician that scaled her methodology using large language model and natural language processing before GPT hit. And I was blown away. And I thought, this is going to be the tool that we all need, to really impact that double-sided marketplace of burnout and need for services that I spoke about earlier. And so that was sort of the turning point for me in saying, this is what we're going to do. And the way that we do that is we've created a platform that hyper customizes based on our providers' data sets, what they want to talk about, what they want to focus on, the methodology that they use, their tone. All of that information goes into a type form that is used to then populate an experience that we create for them that's then white labeled, and it's all back in the hands of our customers, these providers, these fitness companies, beauty companies, supplement companies, because really this is an enhancement tool, because they've already established trust, they've already built the expertise so that they can deploy their own AI tool to help with personalized ongoing support and ultimately better health outcomes for their customers.
Right. Ooh. Now, I have a follow-up question about the experience from the perspective of the expert. I think most of us have heard of the Dunning-Kruger effect, but when we talk about Dunning-Kruger, we're usually talking about how people who don't know what they don't know tend to overestimate themselves. They don't know how complex the thing is, so they don't know what they're missing. But there's another side of Dunning-Kruger, which is that experts forget how hard things were before they became an expert. So they tend to overestimate how easy things are, because they've forgotten what it feels like to be a beginner. And so I imagine that's a major barrier when you're trying to get an expert to document or transfer their own expertise. I think it's often the case that people sort of forget what they've learned. It becomes just tacit knowledge. There's a great German word for this. I think it's Fingerspitzgefühl. It's like fingertip feeling.
Every German word is so it's like a it feels like a nursery rhyme and like also like a they're it's so funny. It feels like there should be like an emotion connected to that.
Oh my
That
God, I know you're right. Yes, yes, and not least, there's just like the always the novelty of that many syllables fitting into only one word.
yeah. Listen,
Right.
finger
So
development,
how do you
that
bridge
could
that
be like
gap?
a scoop. It could be like like a
Right?
finger
How
scoop
do
that
you
you
like? How do you pull the? How do you get? I mean, you can hardly pull the expertise out of an expert. How do you get the expert to almost unspool themselves?
So what we've seen is it depends on our customer. There are some folks that have a very particular methodology. Often they've written a book, they have like courses that they've written. So some of them already have data sets that are evergreen and proprietary. And, when you partner with us, you still keep all that data. We don't, own it. It's all owned by the expert or the organization. And so they really want to train their model on themselves. And then other folks, have like a framework. I think what you're describing is like, I'm bringing to mind one doctor who's a longevity doctor we work with who has literally 300,000 people who are interested in her advice on social media. Like 300,000 people were like, tell me more, tell me more. She knows because she has her own internal data set of like things she likes to talk about with patients, and she's more creatively emboldened on the fly. So she has amazing content, but she's very adverse to this evergreen knowledge of, sitting kind of um sitting content. She does everything on the fly, and that's sort of part of her part of who she is and part of her creativity process. And so for her, I think it depends what kind of like creative you are. Like, are you someone who likes to get all that out there? Are you someone that just is this kind of more on the fly? And for the on the fly, I have to spend time with them. That's just that's just what we have to do. So, um, and then it takes a little bit of kind of like, tell me what your framework is. Where are you working from? You've got this internal model. Like, what does that look like for you? And that's where my skills as a therapist to really pull out some information so we can kind of get it all written down somewhere so that we can then train the model off of, this particular flavor. It's just a different kind of work.
Yeah. Wow. What happens at the other end of that? So you're working with an expert. You there's a day, there's an hour when you like cross that barrier, and the model seems to really come to life in a practical way. What kind of surprises are surfaced? What how how do the experts react when they see this come to life?
Well, they're usually pretty excited. There's usually like some tweaks. So right now, sort of what the novelty of Miri that we have created is if someone has an idea of what they'd want their AI to say, particularly around nutrition support, and then add other features like sleep tracking and all of that, we can populate a product for them in less than a week. So if they come to us and they're like, look, we've got one customer that does fertility. Like, I know what kind of diet works for helping women to become more fertile so that they can have a baby. Here's what that looks like. And I'd like to have not just nutrition tracking so they can stay on track and know what to order at a restaurant. We have capabilities like you take a picture of the menu, it'll tell you what to order based on like all these different types of customers we have, because I'm not the expert on that. I'm the expert on behavioral health, but really that customer is the expert on what to order at a restaurant if you're trying to get pregnant. And so it should be that body of knowledge that tells you what to order, which is entirely different than if you're trying to follow a keto diet and you get our product from a gym, for instance. It'll tell you to order something totally different. But my job is to make it as easy as possible for you to use this product so you can have some preventative measures, think a little bit, have help making those decisions. Take a picture of your fridge, it'll tell you what to cook. You take a picture of food, it'll analyze it for you and tell you what ingredients you should look out for the rest of the day if you're logging that meal. But all of that is contextual based on the data sets that our partners provide for us. And it's really that relationship that we establish with them and then the product that we build for them in about a week with those customizable, not just educational tips, but with tracking features to make it really easy for them to see how their own customers are doing with adherence and accountability and also with their health outcomes. So, say someone's following that diet and they do get pregnant or they don't get pregnant, like that's really important so that we can understand more about that sort of back to the healthcare system changing, that real outcome driven goal incentive.
See, I'm so excited about that because because it gets back to solving that observability problem. Like if you ask me, you could be the greatest nutrition coach of all time. If you ask me what I ate last week, I could not tell you, right? And I don't think that I'm going to be the sort of person to be like, I'm still not the diarist that I wish I was. So I'm probably not going to become an amazing diarist next week. I need AI help. If
you need
take
AI
a
help,
bunch
Michael.
yeah, right. Like
We
to
all do.
take the friction out of the data collection, right? It's not just about being able to consult the nutrition guidance at any time. It's so that when I do connect in person, you can actually see how well I've been following the diet for the last month.
Totally. And not just can, the expert look at that, but also you can look at that, having a way for you to see like, oh, I felt terrible last week. Oh, okay. Like I was eating whatever it was I had cheeseburgers every day. It's like I didn't feel good. And here's ways that I didn't feel good. Like, how can we track that and measure that against our own success metrics to try and better understand ourselves? How can we then share that with people who can tweak our sort of, program in order to make it just right for us? And then how do we ultimately feel better, get better, and not feel so alone? When I think about you on the golf course, I also think about like how nice it is instead of playing alone and watching YouTube videos, like to have someone there to say, great job, or, like, let's try this or tweak that and change that. And I think as we move into this more personalized model of care and we also think about burnout, we can't all have like a nutritionist, a doctor, a all these different kind of services 24/7, but we can start to imagine how good would it be if we could. And I think that's the world that I want to create, where there is a sense of, there is that data and it's going to the right expert and I can get the help that I need and I do have 24/7 guidance. And so we are using that technology at Miri to do as much of that sort of bridging as we possibly can.
Nice. I've had a glimpse of this without the expert guidance, but just my own self-experimentation with the technology I have with Fulcra showed me, for instance, the difference on my body between having one glass of wine in an evening and one and a half. Tiny difference. I could not believe the outcome difference in HRV and lowest heart rate in the night after one glass of wine versus one and a half. Like that was a level of nuanced self-understanding that I didn't have, in the past decade that surfaced just because I had this rich data set of my biometrics that I could finally look at in correlation to these tiny lifestyle changes. changes. That was huge, and that was self-guided. That was not with an expert helping. Yeah, I think this can be huge.
Oh, yeah. It's the power of personalized data. And that gives us so much of that mirroring, and it's enormous. It's huge for us. I completely agree. And then add, the expert knowledge on top of that. We're building products for folks who are elite athletes, for instance, and that's completely different. Their bodies are totally different than folks who, are like me and zooming all day and trying to go for walks when I can and trying to remember to eat protein in the morning. Like it's different, totally different. And how we create those programs is based on the expertise of each of those and the mix of that personalized data sets with a sort of mirroring quality that you're talking about, mixed with that monitoring. So the Hawthorne effect, feeling watched, feeling like, I'm doing this data because it's going to be seen by someone who cares about me. And it's really that kind of sweet spot between the two that we're hitting at.
Right, right. Ah. Here's a hidden dimension of personalized medicine that I think no one's talking about now, but they will. Kind of modulo a wonderful quip of Alan Watts: "You're under no obligation to be the same person you were 5 minutes ago."
I
The
love
fact
that
is,
quote. Wait, I
oh,
have
me
to tell
too.
you a Walt Whitman quote. That was my favorite. That's
Oh,
so similar,
oh,
which
hit me.
is, okay,
Yeah.
it is contradict myself. Well, then I contradict myself. I am large and I contain multitudes. Love that quote.
Yes. Oh, I love that too. Oh, yeah. Um, truly one of Brooklyn's greatest.
You got
Um,
that. It's true.
the right. Both of these heavies are acknowledging that we as individuals also change. So personalized medicine for me at 44 should be different than it was at 34, and will be different at 54. And so it's not just about how I'm different from an elite athlete. It's also how current me is different than future me.
Totally. That's very true. I think we have to, in digital health, there's a balance between creating a product that's valuable because of its hyper personalization and not falling off the cliff of precision data. And it's a really hard balance. There's so many companies that have, sunk because they are chasing precision data when we are a very complicated organism that, is hard to nail down because of our fluidity. And so we have to think about who we are today and acknowledge that, have a goal in mind, work towards that. If that doesn't work, find a new way and kind of keep going until we find what sticks for right now, knowing that that is going to change. And for me, that's a process that involves trust and involves really like a self exploration and curiosity, um, and then and also data, and also understanding the self, and also personalized kind of resources that show you what you need to see, just like the 1.5 glass of wine that kind of tips the scales, which was super interesting. We need all of it together. And in digital health, being mindful of where that line is vital for a company's survival.
Absolutely. That mirrors my approach as an entrepreneur. As a matter of fact, to me, one of the wonderful things about designing and running companies is that there are always works in progress. You never achieve perfection. I think a company is like a person in that it's inherently unstable. There's no way to stand perfectly where you can remain standing without moving your muscles. You need to constantly make micro adjustments. And similarly, I feel like every company is in some unstable state that threatens failure. And the best you can do as a leader is like figure out which way is it going to topple next. Okay, I need to run over there and push it that way. Oh, wait. Okay, now I destabilized it. Oh, got to run over there. That's just the way of things.
I mean, the other thing is like the market also just so it's like constantly a moving target, and there are some wins in the
Yep.
market and then some losses in the market. And so it's like not only is that you're riding the ship, but you're also kind of basing off of our needs as consumers who are interested in novel approaches and wanting to find, for instance, I think like the word holistic care was not in our vernacular like a decade ago. It was more about, let's kind of silo and get the best treatment from each individual vertical. And now we're seeing ourselves as this ecosystem that needs care, that every lever affects every other lever, but that's new. So, as we go into that new space, how are companies adjusting or not, or doubling down based on their knowledge sets and sort of where we're headed in the market too?
Okay, so facing that inherent dynamism, where are your North Stars? Like the as you're navigating this uncertain future, what is it that you're betting on?
I think trust is probably the biggest bet, like relational accountability. What we're not doing is doing our own individual like research assignments to surface our own data sets to train our model off of, because I trust in the experts who've already done that and proven themselves. And, I trust that instead of turning to a new piece of tech, a lot of folks are going to want to learn from people that they already know and trust, or from brands they already know and trust, because that relationship has been established. So I think the big bet that Miri is making, if I were to name one, is around trust.
Well, I think that is an awesome bet. It's certainly something that attracted me to your model and made this conversation something I was very excitedly looking forward to, because that bet on trust is also delightfully competitively unique. There's a lot of work on sort of generic avatar building instead of that, grounding, finding this grounding and trusting the expert, and working to earn their trust and empower them to grow their trust with an ever larger number of individuals. I think that's a very powerful approach that can grow for years.
Well, thanks. I think it goes back to your question around using this tech as a tool to scale care instead of replace. And that's sort of, where I see this really sitting, is that as this technology continues to get better and better, we also need to trust one another that, we're using this for good. We're using this to help decrease burnout, because folks and brands that are in high demand for that kind of concierge service can't deliver that. How can we use this to really supercharge them, make them not just their own methodology scaled through conversational dialogue, but even further with all of the superpower of a therapist that I've put into building this product, and behavioral health modules and ongoing support and the notification systems and the functionality and feature sets that we've built to really improve health outcomes without them having to be right beside every single person, but to feel like that person has a piece of them. And that's where there's real beauty in this technology, because I think we can solve both of those populations' problems if we build based on trust.
Nice. Well, for those that want to learn more about Miri and more about you, where can they find you?
So you can always reach out on LinkedIn, Amy Kelly. That's a great place to find me. You can go to miri.ai and you can look us up there. And those are probably the best resources right now. We're on Instagram as well, and I'll give you my handle to post for each of those.
Fabulous. And that's Miri.ai, Miri.
It is.
AI.
Yep.
I'm jealous of your 4-letter domain name. That's
Oh,
totally awesome.
thanks. It was a perk. It was a perk of the name for sure.